did not address the possibility of having PTSD because it was a stigma. They didn't even have the terminology for it until the 80s. And so my husband's had PTSD since Vietnam. He's actually now 100% disability for PTSD. And so that stress was already accumulating in his system without really being worked on. And then add on to that, our daughter passed 6 years ago this month, and he was with her and he couldn't save her. And he blames himself for her death, but it put him into 10 times worse PTSD. And so over the next 3 years after she died, his health just started really going down the tubes. And he was not a go-to-the-doctor kind of guy because his health appeared to be great, but he knew that he wasn't well, and he would go to the doctor and he would say, I'm not well, and it's systemic. I have a systemic infection. I'm not well. He knew that about himself, and they would say, can't find anything wrong with you. It's just the aging process, and they would send him on his way. And then 3 years ago, we were on vacation on Cape Cod, and he passed out in the car, and called the ambulance. They took him to the hospital. They kept him overnight. They said it was his vagus nerve. He was having a vasovagular episode. I was like, oh, and he's like, there's something really wrong, something really wrong. So he went back to the doctor and he said, whatever tests you do, you know, Dr. Lina was talking about, they do tests. He said, do more, do deeper. And they found out that he has Lyme's off the charts. Every test for Lyme's, he has it to the highest degree. And so there was something going on with his arm also. He went to a neurologist, again, doctor to doctor to doctor, and the neurologist put a stethoscope up to his carotid arteries and said, you need to have ultrasound. He has one completely blocked carotid, and the other was like 60 or 70%. So he didn't have blood going to his brain. So when he would eat and the blood went to his belly, there was so little blood to his brain that he would just like have to pass out because he didn't have the blood. Anyhow, we were, through grace, we managed to, within 3 months, get to the top vascular doctor in Philadelphia. And what he said is that he couldn't operate because you can't operate into those blood vessels in the brain to clear them out. And basically what was happening was, so he had this Lyme's that was very serious, and then basically on top of that, he was having a deadly stroke, but in very slow motion. And he would come down, and they put him on a bunch of medicine, and he would come down in the morning from sleeping, crying, and he would say, I had that dream again, that I went to the doctors, and they said, there's nothing else we can do for you. And I would say, do you want to go to an Ayurveda center? You know, do you want to go and have the full treatment? And he would say, I can't do two things at once. I can't do Western, and I can't do Ayurveda. He said, I'm doing the Western track. So I just told myself, that's fine. I just put it there. And I waited until the day that we went to the doctor and we sat down, and they said, there's nothing we can do. They basically said, go home and wait to die. And he turned to me and he said, let's do that Ayurvedic stuff. I'm also a yoga teacher, and my teacher in Philadelphia, Swami Nirmalananda Saraswati, she had been coming to Dr. Lina already herself. Swamiji travels around the world, and she has Ayurveda around the world, and she said, go to Dr. Lina. She said, don't even go to India for Ayurveda. She said, go to Dr. Lina. So it's like, you know what? If it's good enough for Swamiji, it's good enough for me. So I called the office, and I was calling to set up a phone consult. And while I was talking to them, Tom called out and he said, ask them if we get in the car now and drive up there, would they take us? And they said yes. And he was so bad. He barely had words. He was aphasia. He could barely use his legs, and he could barely use his arms. I prayed the whole way out that he would be alive when we got here. I just wanted to turn him over to somebody else. It's like I didn't want him to die on my watch. That's how I felt. My daughter died. I didn't want my husband to die on my watch. We got here. We stayed in a hotel the first night. I prayed the whole time. Let him be alive. You know, when we get to the Ayurvedic center, just let him be alive. And we got there, and Dr. Lina will tell you have to be helped into the room. He couldn't say the words for what was going on with him. She talked with him for half an hour, and right out of the room and in for punch coma, like just that quickly. So we were here, I think that first time, maybe 10 days?
10 days.
And then we came back a few months later for 10 more days. He couldn't make it the full 10 days the second time. It was, as gentle as it was actually too much for him. That was when Dr. Lina realized. She would say, Ayurveda is not fast, but she would say, for you, Tom, it's even slower. You have to slow it down even more. So this is now 3 years this month. It was 3 years ago, September, that we came. And he said it yesterday. He said, if anybody asks, he said, you can tell them I'm 100% better. He drove the whole way out here. He's a motorcyclist. You see his picture up there with the goggles and the beard and the mustache and the motorcycle cap on. That's Tom. He's riding his motorcycle now a little bit. He has much more mental function. His legs are much better. He still has a ways to go. His arms are much better. He still has a little ways to go. But his spirit through all of it has been astounding. I don't think in the 3 years that he's had 10 days of being depressed and morose. And that's one of the miraculous things about it also. He's off all medications. He takes 1 aspirin a day.
How was he when you drove back after the first?
That's one of the things about it. It's not a miracle process, so I still have to, drive out and back. He only was able